Hi, good evening. So today is day 15 of daily posting of NEET MCQs in our Telegram channel. The name of our Telegram channel is Medaffin Academy. Okay, and we do post 20 to 30 MCQs per day. Currently, we are posting only 20 MCQs, and we intend to post somewhere around 1000 to 1500 MCQs by the end of this NEET PG exam. So we will be posting by 29th August. We will be posting somewhere around 1000 to 1500 MCQs, and the drill will be the same. Every day we post first question at 8 a.m. Every half an hour we'll post the other questions. The last question will be posted at 5:30 p.m. and 7:30 p.m. is the time you will get. Till that time you can choose your options, and 8 p.m. we will go live. This is the daily drill, and we have been doing it for last couple of days. Almost we have done uh, 13 days, because 2 days we couldn't do it because of technical issues, the live stream. But every day we are posting around 15 questions, so that we are doing on every day. Okay, so the reason we are doing is we want NEET PG aspirants who are giving exam this time or intending to give exam in 2027 benefit from these daily NEET PG questions. So even if you follow the channel, uh, if we continue in the similar way, you will be getting somewhere around 600 to 900 questions per month. And just by following channel, this Telegram channel, you will be revising even without you knowing it. So what we do is, once the live session is completed, we will share the questions, answers and explanation at around 10 p.m. and we have been doing for last 15 days. So if you see, we have shared for 10th of August, and today we will share 11th question and answers at the end of the session at 10 p.m. Okay, so if you are not a member, you can join our Telegram channel just by scanning this particular QR code, or if you are watching it live, I will post the channel link in the live chat so that you can subscribe to our Telegram channel. We don't sell anything, we don't sell package, we don't sell anything. Like, we want it to be a channel where it is purely discussion about preparation for NEET PG. Okay, so saying that, without further ado, let's start today's session. We'll just discuss what are the questions which were posted, and how much percentage of participant got it right, and what is the correct answer. Rather, we will not go into discussion of the answer because it consumes more time, but we'll just mention these things so that even you can see which topics are frequently getting wrong, and you can focus on those topics. Okay, so the first question for today, which is posted at 8 a.m., is: what is the purpose of using the modified Duke criteria and diagnosis? Okay, we have 11% given their answer as infective endarteritis, 11% given their answer as infectious mononucleosis. The 78% has given their answer as infective endocarditis. I guess one have selected it as infective endarteritis just by like not fully reading the option. It can be a possibility. So most of the times we will assume just by reading two or three or four letters that that's a assumptions will make you choose wrong answer. So whenever you feel like you are getting similar kind of options, read each option carefully, select it. Okay, the correct answer is infective endocarditis. Coming to the next question, this is a image based question, and we do also post somewhere around 8 to 9 image based and video based question. We are posting currently only one video based question, but we are preparing something big for people who are part of the Telegram. We will be posting somewhere around 150 video based question module for you to practice on your own, right? So you can just click on the question answer and get the explanation at the end of the session. So we'll be doing it that the in soon, like we still have 19 days. We are preparing, and we will do that, and we will share it for free for the members who are part of the Telegram channel. So if you want to get that, just scan this QR code or click on the link in the live chat, and you will be part of our Telegram channel. Coming to the question, what type of fibroid is shown in the image above? We have 72% given their answer as subserosal, and 14% each given their answer as submucosal and fibroid polyp. The correct answer is subserosal, and this is the uh, anatomical thing which they want you to identify. So these are actually subserosal. These are pedunculated, and these are uh, submucosal and intramural. So these are pedunculated also. Yeah, these are actually attached to kind of pedunculated but outside. Coming to the next question, this is also one more image based question. While performing surgery on a 2-year-old child for acute appendicitis, the structure given in the image was found 2 feet proximal to ileocecal junction. It was measuring 2 inches in length. What is the diagnosis? So this is a structure, right? And this is the thing which you want to observe and make sure that you give correct answer and select correct option. 72% has selected it correctly as Meckel's diverticulum, and 14% has selected as sarcoma, 14% has selected it as Zenker's diverticulum. Okay, the correct answer is Meckel's diverticulum. So a person was involved with an accident, and he was taken by local people to the hospital. He was not a complaint by he is not a complaint by any of his relatives. He is not accompanied, sorry, there was a typo. He is not accompanied by any of his relatives or friends, as the condition of the patient was bad. The doctor have to suggest him emergency surgery according to the ethics. What should be done? So the 80% has given their answer as doctor can do surgery in case of emergency. That's a correct answer. Like to life saving procedure is like it has to be performed, and even if there is no consent, you have to do that because you see that there is an impending danger of mortality. So to prevent that, you can do this even if you don't have privilege, but you have skill to do it. Coming to the next question, mucolic cells and Russell's bodies are seen in. Okay, 66% has selected their option as rhinoscleroma, 17% has selected your option as rhinosporidiasis, and 17% has selected their answer as rhinophyma. The correct answer is rhinoscleroma. Okay, so these cells and bodies are seen in rhinoscleroma. So this is also like a good question. Coming to the next question, we have vitamin K is given at birth to prevent the following. We have four options. 83% has given their answer as hemorrhagic disease of newborn, and 17% has given their answer as newborn diarrhea, and the correct answer is hemorrhagic disease of newborn. Okay, then so it is also a easy question. Coming to the answers, so almost everything is correct. Like everybody has given their answer correct almost. So this is another image based question. A 30-year-old car driver was involved in an accident. He is brought to an ER with complaints of breathlessness. On physical examinations, vitals are pulse rate is 110, BP is 90/60, temperature is 37 degrees. Extensive bruising is noted on the right side of the chest, and urgent bedside CT X-ray was performed, what is the best management in this case? Okay, if you see the BP is unstable, and if you see the full X-ray, there is fracture of ribs here. You can see, okay, multiple fracture of ribs. Okay, so the correct answer is uh, patient with multiple fracture of ribs and a hypotensive situation. 60% have selected their answer as elective intubation and IPPV. Okay, 40% has selected their answer as thoracostomy. The correct answer is elective intubation and IPPV. So if you wanna have full explanation of all these questions, even today, even if you are not member right now, you can become a member and get the answers for all these questions at the end of this YouTube session. Somewhere around 10 p.m. we will post a full PDF. Okay, so these PDFs will also be very helpful for rapid revision. Coming to the next question, a 54-year-old chronic alcoholic patient presents with altered sensorium and confusion. He complains of weakness in both lower limbs and occasional tingling in legs. His staple diet include white polished rice. What is the likely diagnosis? The correct answer is beriberi disease, and 67% has given their answer as beriberi. So only 33% has given their answer as pellagra. Okay. Coming to the next question, which organ has the highest chance of graft rejection response? We have four options again 67% has given their answer as gut, and that's the correct answer. 33% has given their answer as skin, and the most highly rejected transplants is from gut transplantation has high chances of getting rejected. Okay, coming to the next question, a stable 25-year-old farmer was admitted with acute onset fever, cough and dyspnea. Chest radiograph showed findings of pneumonia, for which he was treated with antibiotic, showed good response. After 1 month, he again presented in the hypoxemic state with progressive dyspnea. Chest CT showed diffuse ground glass changes. Transbronchial biopsies show the options. I mean, they are just asking like what are the organisms that will be shown when you do transbronchial biopsies if the patient has presented in this way. Only 33% has given their answer correctly. It is thermophilic actinomyces. The clue comes from the question. He's a farmer, 24-year. Okay, acute onset of fever and relapsed again after 1 month with progressive dyspnea. Okay, so this is a tricky question. It means these are the questions which you need to uh, follow regularly, so that it will definitely help you revise these kind of questions. The correct answer is thermophilic actinomyces. The other options given or selected by our members are Aspergillus fumigatus and Aspergillus flavus. The correct answer is thermophilic actinomyces. All are fungal infections. Okay. Coming to the next question. A MRI scan of a non-pregnant female with complaints of galactorrhea revealed a large pituitary tumor. And who is not willing for surgery? What is the following? Which of the following? Not what is the. Which of the following is the best drug for treatment? You see, even I assume that it is what, but actually it is which. So read the question properly. So the correct answer is bromocriptine. Second is promethazine. Number three is octreotide, and fourth is clozapine. Okay, the correct answer is bromocriptine. She is a non-pregnant female who don't want surgery, and she has a pituitary tumor that is resulting in galactorrhea. Okay, coming to the next question, identify the marked structure. Okay, anterior superior iliac spine, anterior inferior iliac spine, ischial tuberosity and pubic symphysis. We all know that pubic symphysis is here, so obviously you can rule out that. And ischial tuberosity is also not in this particular location. So either it can be anterior superior iliac phase spine or inferior superior iliac spine. The correct answer is anterior inferior iliac spine, and only 60% has selected their answer as anterior inferior iliac spine. Coming to the next question, cough following scratching of external acoustic canal is due to. Okay, we have four options again. 66% has correctly selected the answer as auricular branch of vagus. Only 17% has selected each, like selected auricular temporal nerve and great auricular nerve. The correct answer is auricular branch of vagus. So for full explanation, be part of our Telegram channel. You will get a PDF. So these, what are these horizontal lines called? Okay, this is a simple question, but if you suddenly see it, you will get confused whether it is dermatomes or blascolines. Okay, the correct answer is blascolines, and obviously confusion led to people marking it as, like aspirants marking it as dermatomes. The correct answer is blascoline. Coming to the next question, another image based question. An infant presents with condition as shown above after pharyngeal infection. Okay, the shown condition is, so we have 75% selected their answer as staphylococcal scaldal skin syndrome. That is correct. That's the correct answer. The other option which is selected is impetigo contagiosa. The correct answer is staphylococcus scalded skin syndrome. It is triple S. Okay. Coming to the next question, another image based question. This is a flow volume curve. Okay, so what is the, like this is the correct or regular normal flow volume curve, and this is the patient's flow volume curve. So based on this finding, what is the diagnosis? Okay, so the correct answer is COPD. Okay, because it is more in exhalation, like there is a dent in exhalation, it is very difficult to there is a problem in exhalation. So it's the correct answer is COPD. But only 40% has given correct answer. 60% has selected their answer as interstitial lung disease. So this is kind of easy but a tricky question. So just observe this question, and yeah, for similar kind of questions leading up to August 30, or even if you are preparing for next year, join our channel, because we will not stop. We will be doing it continuously. Continuing to the next question, it is a slide. Okay, histopathological slide. A child presents with difficulty in eating due to jaw swelling, okay, and enlarged cervical lymph nodes. Lymph node biopsy report is shown above. What is the clinical diagnosis? We have four options, and 80% has selected it as Burkitt's lymphoma. Okay, and it is like star shaped cells are the hallmark of this kind of lymphoma. Okay, so you can see the answer is Burkitt lymphoma. I mean, starry sky. Okay, you can see these are like stars which are appearing in the sky. Okay, coming to the next question. Again, risk factor for Alzheimer's disease. Okay, we have four options again. 75% has correctly chosen their answer as ApoE4. Okay, only 25% has selected their answer as ApoE3. The correct answer is ApoE4. Okay, so almost 75% has correct their answers as, so ApoE4. So if the ApoE4 levels are increased, there is a chance of Alzheimer's disease. Coming to the last but one question, and I think we started little late, maybe 2 to 3 minutes or 4 minutes late because there was a technical issue. And I guess we almost completed almost everything in 20 minutes. It means like 20 questions will be discussed in 20 minutes with answers, but explanations you will be getting only once you are a member of the channel. A 60-year-old man detected with carcinoma bladder. Which of the following medications can predispose to bladder cancer? Okay, we have four options: tamoxifen, taxane, cisplatin, cyclophosphamide. The correct answer is cyclophosphamide. 67% has selected their answer as cyclophosphamide. Okay, coming to the question again, this is an image video based question. You can observe the video. Okay, so I'll read out because in YouTube you may not see it properly. A 2-year-old unvaccinated child presents with 4-day history of high-grade fever, severe cough, coryza, so runny nose, and conjunctivitis. Physical examination video of the child's oral cavity shows cluster of tiny white grain of salt lesions uh, on a erythematous base located on the buccal mucosa opposite molars. It's very elaborate description. Okay, a descending maculopapular rash has been begun to appear on the child's face, supplementation of which specific vitamin is proven to reduce the morbidity and mortality in this infection. Okay, we have four options: vitamin C, vitamin A, vitamin D, and B12. And correct answer is vitamin A. So even like 50% has given a correct answer, and it's actually Koplik spots, case of measles, right? And if you ask what is the diagnosis, it is an easy question, but they went beyond and asked what is the medicine that you need to give so that it will benefit the patient, right? The correct answer is vitamin A. Okay, so what we understood or what we are expecting is like this time almost 25% will be image and video based questions, so it will amount to almost 40 to 45%, 45 questions out of 180 questions, right? And we are also expecting certain long form questions which are multidisciplinary involvement, so you need to have logical thinking power, right? So you will find all these questions in our Telegram channel. And the good part is we don't want you to buy anything from us. Everything is free, right? And we want you to be part of this channel to get benefit out of this initiative, right? So if you like this, please subscribe to the Telegram channel. Once again, you can see the QR code here. Just scan it. You'll be part of the Telegram channel, or you can also click on the uh, link in the live chat and you will be part of the Telegram channel. If you are not a subscriber to my YouTube channel and you happen to watch this YouTube live, please subscribe to my YouTube channel. I'll be posting a lot of interesting stuff for healthcare professionals. We are going to do a lot of webinars in again not only the NEET PG preparation, we'll be doing a lot of things on YouTube. Okay, so if you are a healthcare professional, MBBS doctor, or if you are preparing for NEET PG, please subscribe to my channel, like the video, comment below, share, so that it will reach more people. And so yeah, see you tomorrow again, and let's do the good work. All the best. Do the reading. Join our Telegram channel. Get access to the PDF which we'll post at 10 p.m. today. Thank you.